My name is Liz, and I've been a patient of Miami Designer Smiles for approximately 20 years. I became a patient, then my husband became a patient, and then my daughter, and then my parents. The procedures I routinely have are obviously maintenance. I have a cleaning and x-rays every 6 months. I would say about 8 or 9 years ago, I suffered from bruxing and grinding my teeth, and I was wearing away my teeth, and the doctors asked me if I'd be willing to be a patient and go to LVI. They were in the process of getting their certification at LVI and asked if I'd be interested in getting a full mouth reconstruction orthotic. I thought about it long and hard, and I evaluated the pros and cons, and I decided to move forward. Life before my full mouth reconstruction was, I had a lot of headaches. I didn't realize that my body was kind of slanting towards one side. I had a lot of headaches. I was grinding my teeth, and there were symptoms that I kind of learned to live with, and Dr. Garcia kind of tied them all together. He showed me clinical evidence of me wearing away my teeth, and between the x-rays, the pictures, and the symptoms I displayed, he goes, "I think you may be a good candidate for this." He did a temporary template, if you will, of what my teeth would look like, and when I exhibited comfort and I felt comfortable and a lot of the symptoms subsided, he goes, "Okay, this is a comfortable bite for you." He made that decision right clinically, and we worked together for about a year or so, and once we were happy with the comfortable state I was in, that's when we decided to move forward. I had veneers in the anterior, upper and lower anteriors, and then I had what you call partial crowns, or what they call toppers, which is just to add height or vertical dimension in my posterior teeth to open my bite. I felt very confident that I was in good hands, and what I was going to have done was going to benefit me long term. So it was the right thing to have done, and I have no regrets. What makes this practice different than other practices in the Miami area is the doctors stay current with the latest technology. They stay current with different treatment options. They invest in their staff, and what I mean by that is their staff and their team is constantly getting trained on different techniques, and in order for a practice to thrive, you have to be able to grow and change with the time. So not only do they invest in themselves, they invest in their team, and it shows in the way they treat their patients, with the procedures and the technology and the equipment they have in the office. I feel very confident and comfortable to have my family come here, and if I have any concerns or if I have doubt, I feel very comfortable in speaking to Jennifer, the doctors, or anybody on the team, and they get all my questions answered, and we address pretty much anything and everything. Well, it's like family. Everyone knows us. We've been coming here for a long time. They treat us with a lot of love, respect, and it's just very friendly. My mother comes to Miami Designer Smiles. I'm a patient here, my husband's a patient here, my daughter's a patient here, and I have a lot of experience, and I have a lot of relationships with doctors in the community that I work with, and I come here because I'm confident in the treatment, and I'm confident with the way they treat me and my family.